So ACL injuries are amongst the most devastating in sports. During the Winter Games, you may recall we saw Olympian Lindsey Vonn crash, tearing hers. It's brutal to see. And it's an injury we're seeing on the rise, especially in young people and especially in women. So joining us right now, Dr. Brooke Pengel from HCA HealthONE, Rocky Mountain Children's. Thank you so much for joining us on this topic that we were talking about during the break already. But first off, can you just give a brief explanation of what the ACL does and how common this injury is nowadays?
Yeah, so the ACL is a stabilizing ligament in the knee. So we really do need it for doing sports with pivoting, cutting, landing. And unfortunately, with that high demand in sports, injuries happen to the ACL.
Yeah.
And they're happening at high level because the participation is at high level intense.
Yeah, I mean, a New York Times article writes about this. They say women are more likely to tear theirs. You talk about more participation. Is that the main reason why we're seeing more ACL tears in women?
Yeah, if we were to look at females, I mean, it's a little alarming that females are, depending on the study, 2 to 8 times more likely to tear their ACL. That's shocking, right?
Yeah.
And yes, there's more participation year-round. I mean, kids are playing sports year-round, you know, specialization, same sport with really not a lot of rest and recovery time, and that leads to fatigue, and then fatigue can lead to injury. But there's just more participation in general.
Yeah. So I have my oldest daughter plays volleyball. My youngest daughter is a dancer. But are there any specific sports that maybe I should be concerned about, or that you're seeing, you know, where these ACL tears are happening more?
Yes, absolutely. So soccer, basketball, football, the sports mainly that have high demand on the knee for pivoting, cutting, landing.
Gotcha.
Skiing is very high risk, as you mentioned at the beginning. So those are the sports that we really need to tailor some of our prevention strategies towards.
Before we talk about prevention, I do want to talk, because we talked about, you know, growing up, we didn't really have this culture of club sports, right? Playing year-round sports. Does that play a role into what we're seeing as well in terms of ACL tears and the increase of that too, you think? Or?
Yes, it does. Participation in club sports has been shown to be a higher risk of ACL compared to rec and a little bit more casual activity. It's, again, the intensity, the volume, the lack of breaks.
Yeah, definitely got to monitor that for sure.
Yes.
All right, let's talk about prevention. What are the best practices, best tips for preventing this? It's brutal.
Honestly, the great news is that we can't prevent all ACL injuries, but there is a program that can be instituted that will prevent. In fact, the most recent 2026 data of reviewing multiple studies says that prevention programs have 54% reduction in ACL injury, which is huge.
We only have a few seconds left, but what are some of the things in those prevention programs? Like, what are some of the things that you can practice?
It's basically neuromuscular training, because a lot of injuries of the ACL are non-contact, okay? It's just a bad landing that isn't absorbing the forces. So we train athletes on landing mechanics, training lower extremity strength, like quad. Most athletes are quad dominant, so we've got to get the hamstring stronger, the hips and the core, so that absorbing the landing goes better. Yeah,
that's all good stuff. Doctor, good to see you. Thank you so much for being here. We appreciate that. You can watch all of our interviews, by the way, on our website at cbscolorado.com. Kennedy?
Well, spring is in the air.